also conserving the bandwidth. Also, everyone, please feel welcome, feel free to engage, but also let's be mindful and respectful of everyone's opinion and everyone's engagement, and welcome once again, and we look forward to having you. I'll hand over to Liberty from Gender Dynamics.
Thank you very much, Immaculate. Greetings, everyone, and welcome to the opening session of the Amplifying Chance and Gender Diverse Voices from Southern Africa series of conversations. Now, before I continue, I just want to warn you all that I am zooming in from my hometown of Darling, outside of Cape Town, in the more rural parts of the Western Cape province. And due to poor internet connectivity, or rather poor network coverage, that my reception is quite bad. So I hope that you will excuse me if I do not come across quite clear at times during the course of this conversation. So I spoke to a colleague of mine from Zimbabwe. I spoke to a colleague of mine in Zimbabwe and explained that these are rural challenges that we can't connect. To which he highlighted that internet connectivity is not only a problem in rural context in Africa, but also very much so in urban context as well. I think we would do well to keep this in mind during these conversations as we seek to start breaking down the digital divides that exist in our region and on our continent at large. In 2014, the independent expert on SOGI, Victor Madrigal Borlos, stated that most often than not, the most marginalized amongst us are left the most and the furthest behind. As the world adopts new pathways for global development, it is absolutely critical to understand how divides, such as the digital divide, will likely shape accessibility to human rights realizations in the future. When this online platform was conceptualized a few weeks ago, between Gender Dynamics, Iranti, and the Southern Africa Trans Forum, it was done with the hope of fostering greater respect for partnership and collaboration as a foundation for regional solidarity. Through this platform, we seek to strengthen the regional coordination function of the SATF in relation to all of its partners, and also get a deeper sense as to the needs in our sector at this very moment. All the conversations will be documented to support this process. As the global community race to slow down and halt the spread of COVID-19, we are reminded that in Africa, the worst is likely still to come. One estimation provides that the overall fatalities for Africa on account of COVID-19 can peak at 300,000 if not managed well. As African governments apply the World Health Organization's guidelines, we question how our interests are protected during the implementation of such response mechanisms, and particularly within the African context. In addition, we remain unconvinced that health data collection tools are optimally able to collect trans-specific data. At national and local level, we continue to see how our community members are invisibilized. We know very little as to what measures our governments have put in place to protect trans and gender diverse persons and sex workers, especially people who are living with HIV and are drug users. These are two examples. We do not know the true extent of human rights violations that have occurred up until now as a result of COVID-19 responses. In many instances, all we have are anecdotal evidence in the form of personal conversations, individual complaints, videos that are being circulated, and media reports detailing how African governments are using this dire moment as an opportunity to persecute LGBTIQ+ people. Unlike many other parts of the world, particularly the global north, Africa has its own unique challenges, none greater than entrenched inequalities. Eddie Ndopu from the United Nations emphasized that the threat of coronavirus in Africa flags a much deeper crisis of global solidarity. The failure to eradicate extreme poverty in Africa, coupled with weak political leadership, will remain the single biggest issue strengthening the health and well-being of our countries, region, and people. Our invisibilization and erasure from response mechanisms in this moment has its own price tags. And these price tags comes in the form of feelings of helplessness, anxiety, depression, and suicidal ideation. Mental and physical well-being during this time is deeply challenging and deeply troubling. Today's conversation will reflect on all aspects of mental and physical health and well-being for trans and gender diverse persons across Southern Africa. As trans and gender diverse persons from this region, and together with our allies, it is our hope that we can identify new opportunities and come up with different solutions that are led by us and that are right for us. As funders gear up to resource global and regional actions to combat COVID-19, so too must we be regionally coordinated and ready to implement. I want to especially thank the operational teams of Gender Dynamics and Iranti for taking care of all of the logistics that went into convening this particular online space. Thank you also to our facilitator, Madam Jolarina Timbo, and the panelists for leading this first panel as we kick off the series of online conversations. To all of you listening and tuning in, please enjoy the conversation and we look forward to your contributions. I'm now going to hand over to Jabu from Iranti to also give some introductory remarks to this first Inception meeting online for our region. Thank you.
Thanks, Liberty. Hi, everybody. I'm really happy and thankful for just the GDX team for making sure that within this absolute global pandemic, that at least us as trans, non-binary, gender diverse people can come together, even in a virtual environment, to talk about a number of issues that are impacting on our lives, preceding COVID-19 and now within this pandemic, and what even our future as trans people would even look like in relation to access to healthcare, legal gender recognition, and a range of other issues that impact on us within the region. In particular, I'm also mindful that all of us in this space have been working under varying degrees of difficulties, some more than others, some more privileged, others less privileged around digital access, financial abilities to equip teams to be able to work, and so forth. And I'm hoping that this online space can really grow a solidarity space to creating what it is that we need as trans activists and trans persons in this particular time. I also want to say that one of the discussions also that we will have, not necessarily today, but it is regarding two baseline studies that the Southern African Trans Forum, and which is all of us pretty much within the region, would be embarking on, to look at the impact of COVID-19 on our individual lives and on our movement lives overall. And we will call on you to please reach out and engage, and to make sure that we can reach as many trans people as possible to be able to understand what exactly the veracity of the pandemic has on our lives. So with that note, I also just want to say that I would have to get off the call at 2:30, and I apologize for that. But I'm going on to another emergency call to talk about emergency funding from the International Trans Fund to address the COVID pandemic. So I'll be on for the next 20 minutes. Thanks again.
So we will now, hello. So we will now hand over to Madam Jolarina, the Executive Director of Wings to Transcend Namibia, to facilitate the next this particular session, and then, of course, introduce the panelists accordingly.
Thank you very much, Liberty, and thank you very much, Jabu, and to the entire Iranti team. As alluded to, I'm Madam Jolarina Timbo, and I'll be facilitating the discussions today. On our panel, the topic today that we're talking about is mental health and physical wellness of the trans and gender diverse persons during the lockdown. And so I would be joined by Anil from South Africa, Gender Dynamics. I'll be joined by Dionce from Namibia, Tiamon and Southern African Trans Forum, and Sam from Zimbabwe from TRID and also SATF. I wouldn't mind each of you briefly introducing yourselves and for everybody to hear your voices, and also just to start off the conversations, please to introduce yourselves and we'll take it from there. Thank you.
Okay, so hello everyone. I hope everyone can hear me. My name is Anil. I'm a trans man. I'm work for Gender Dynamics as the Health Advocacy Officer, and I am based in Johannesburg at the moment because I'm locked down here in Joburg with my family.
Okay. Hello everyone. My name is Sam Jean Lovu. I'm the director of TREAT, Trans Research Education Advocacy and Training, an organization here in Bulawayo, Zimbabwe. Oh, and I'm also vice chair to the beautiful Miss Dionce.
Yeah, go ahead, make me blush. Okay, this is me. Hello, everyone. My name is Dionce Naris. I am the director at Transgender Intersex Androgynous Movement of Namibia, also the chairperson of the Southern African Trans Forum, pronouns she, her, hers. That's it, right?
Yes, we can hear you, Dionce. Please continue.
Okay, I thought I did that. So my name is Dionce Naris, director at Transgender Intersex Androgynous Movement of Namibia, for short TMON, which is also then the chairpersons of the Southern African Trans Forum. My pronouns are she, her, hers, and I am a trans female again. Thank you.
Thank you, everyone. So just to start off the conversation, as alluded by Liberty, there's basically around an estimated 3,000 fatalities that would happen in Africa as a whole due to this pandemic. So what do we feel the situation is on the ground, the general situation on the ground of our communities? Basically, that is what I would first want to understand so that we can definitely start with a basis from where we were, where we are, and where we are going. So if each of the panelists can please just tell us what is the basic, the situation on the ground right now due to the lockdown for our communities.
So if I can start just with the South African context, I read a quote the other day from Professor Salim Abdullah Karim, who's a South African infectious diseases specialist. And he said, our lives when we go back after this lockdown are simply not going to be the same. So I think that from the South African side, we're in abnormal, and this is the new abnormal, because I don't think our normal was ever very normal. I think we were in a very inequitable state, and I think that our inequalities are deepening, and this is being shown up by the pandemic. So I think that's the context that we're grappling with in South Africa, is that we're grappling with what is the new normal, and there is no new normal. This is our new abnormal.
Okay, maybe I can just give a brief run through the situation that's currently pertaining in Zimbabwe. So basically, in our context, we are in a bit of a sketchy situation because the medical system itself is totally messed up. We do not have ventilators or protective material for those working within medical institutions. So saying that our country is not prepared would be an understatement currently, and more so looking at the situation for trans and gender diverse persons. I think one of the biggest concerns with the lockdown is also in terms of, besides the lack of mobility, in order to assist each other with various needs that community members have. There's also the issue of, in the event that anyone needs to leave their home to replenish supplies, or in the event that they need to access any other service, the issue of the documents that we carry, and being in spaces where that are heavily militarized, it's really a big concern, because the disparity with your documentation, it poses a great risk. So this is just one of the many challenges that we are currently faced with within this point in time with the pandemic.
Yeah, so I'm thinking, just picking up from where the comrades are leaving off. The situation for me, again, seems to be the same, because I can speak from a Namibian context, but I can also speak from a point of view where I've been checking in with some of the comrades across the continent on how lockdown is affecting trans persons. And we can definitely say that the amount of violations that are happening against trans bodies is on the rise. Just looking at safety and security issues, and SM was saying, just being able to pick up essentials to get to a shop. You know, people face harassment. There's just issues around little discrimination where somebody gets stopped and you get things like, hey, you say madam or whatever, what are you, where do you think you're going? You know, just little things like that that can upset people. And then, which takes us to the issue around mental well-being support in this space where people are going through violations. Could we please have mics muted?
Can I please have mics muted, please? And everyone, your mics except the speaker. Thank you.
Thank you. So yeah, so when you're looking at things like mental well-being support, and even the operations of organizations such as ourselves, as restricted because we might not necessarily be regarded as essential services. And in some countries, organizations are not even registered and do not have the legal status to even attempt to apply for essential service status. So limiting how we even reach our people and how we can give support. When you look at mainstream systems like the food banks that our governments are running, even that space is not an enabling environment where trans bodies can come openly and come and claim service, because this institutionalized stigma, there's the disparity between the documents that you carry and the person that you identify. So even the registration process in itself is traumatic for trans people to just go through to get basic aid on food materials, right? So people are sitting in homes where they have just shortages of food items or toiletries. And this might be a support area that we want to look into. issues around mental well-being and support, where people are in isolation and being in isolation, where some people do not even have the necessary support, would probably be sitting in a space where processing their own trauma that usually they would not have to face because they would be outside, I guess, doing things that would take their minds off simple things like body dysphoria. And let me not underplay it by saying simple, but things like body dysphoria that people go through would now be evident to deal with because you are stuck in a space 24 hours a day by yourself. So this little thoughts creep in. So how do we deal with supporting people in just mental well-being, right? Let me let me stop there.
If I could also just say, coming in on that from a South African point of view, and I just want to say that in terms of mental and physical health, I think they're non-binary. So, and there's a lot of overlap. So I'm going to be non-conforming and kind of speak about both of them at the same time. In terms of the impact on COVID-19 on specifically trans and gender diverse community in South Africa, we've seen that access to gender affirming healthcare has been interrupted. And I'll speak a bit more about this in a minute, about why this is a really important issue, whereas COVID seems to be overshadowing everything, but this is an important issue for the response to the COVID pandemic. Surgeries have been cancelled in South Africa because anaesthetists are on standby for intubating patients and putting them on ventilators. So surgeries are not going ahead. Access to hormones has been interrupted. We have a lot of people who are telling us that their transport has been disrupted. They can't get taxis to get to the hospitals and clinics that they usually attend. And then we also have people who during lockdown are locked down away from their services. So I, for example, have a friend who had a choice to either be locked down alone in a township in Johannesburg or to be locked down with his family in rural Mpumalanga. So he's chosen to be locked down with his family, but that means that he has no access to hormones and he is without treatment at the moment. And this is obviously very psychologically grueling for him. And then clinics are operating at reduced hours. They're trying to distance within the clinics, so they're taking fewer people at a time. Waiting times are longer. If you can get in, you're going to wait for a long time. And people are fearful and not wanting to go out and go into medical spaces. So a lot of people are going off treatment at the moment. But that's just the people who are lucky enough to get treatment. As always in South Africa, anything that impacts on the country impacts the hardest on the poor and the most marginalized sectors, because as I said, we're such an unequal society. And this pandemic has really had its hardest, heaviest impact on the homeless and the marginalized groups. Liberty spoke at the outset about sex workers, and sex workers have really borne the brunt of this. Homeless communities have been scattered. They're separated from the organizations that were reaching out to them and working with them. Sex workers are faced with the choice that sex workers always face in these conditions, which is either you continue working and you risk infection, or you stop working and you risk being left absolutely destitute. And there is very few organizations that are working with sex workers and addressing their position as one of the most marginalized and vulnerable groups in this pandemic. And then we're looking at a trans community that's actually extremely vulnerable to COVID in a number of ways. We know that HIV rates amongst trans women are some of the highest of any community group. And that's because of the intersecting layers of oppression that we find, based on race, based on gender, based on socioeconomic status, and based on being transgendered and extremely marginalized and oppressed group. These are the people who are impacted by these layers of oppression, and that is what results in us having this HIV burden on this particular group. We also have high rates of smoking in the trans community, and that's also linked to stress responses. And smoking is a known risk for complications for COVID-19. And then we have trans men, many of whom use binders. And binders are a significant risk for complications for respiratory tract infections because they are an existing risk for congestion in the lungs and respiratory problems, and COVID's going to exacerbate that if people contract COVID. So we're looking at specific factors that are making trans and gender diverse people more vulnerable, and we're looking at a really vicious cycle where we have a lack of access to gender affirmation, and that then results in people being at higher risk of factors that then make them more risk adverse to for more at risk for COVID infections, particularly pneumonia. And then you have COVID impacting on the medical system and draining state resources so that people are less willing to provide gender affirming treatment. It seems like a luxury. It seems like something that's not important in the midst of this pandemic. And that then decreases access to gender affirming healthcare. And that then increases the risks that the trans and gender diverse community face. And I think it's our response now that's going to make a difference on whether we can put this on the agenda and take up the challenge of bringing this to the fore, as this is not a side issue. This is one of the central issues in this pandemic, is how do we respond to the needs of the most vulnerable groups in our society.
Thank you very much, Anil. And also just highlighting that already as transgender and gender diverse and non-conforming people, we've got multiple issues and challenges that we face regularly, right? And then comes the COVID-19 with its added issues and lockdown measures and health system in disarray. So does this mean that as trans communities, the access to healthcare is impacted in a very major way? And what should we as organizations, community do in order to be able to be more cognizant and be more, to take up more protective and safe measures in order for us to be safe and well at the end of the day? So yeah, so that is the question. What do we need to do as communities based on all of these many factors and multitude factors? What do we have to do in order for us to be able to stay safe and be healthy during this time? There were issues around homelessness mentioned. There were issues around poverty mentioned. We know that there are high unemployment rates within our community, right? And that already has an impact on our mental and physical health. So as trans and gender diverse community during this lockdown, what do we need to do? And what type of measures have our governments put in place for us as trans and gender diverse persons when accessing healthcare, for example, or going out into the street to do grocery shopping, for example?
Okay. I think with many of the community that we work with, you'll find that, as you have rightfully mentioned, people, many of them are unemployed. They rely on informal trading, sex work, and other self-motivated initiatives in order for them to earn an income. And currently we find ourselves in a situation where people are unable to even have the basics that they need for them to be able to survive. You also find that some of them, the issue of being in homes and negotiating personal space, it's very difficult. We have a situation where even one particular community member is actually being is being deprived of food within the family setting simply because of who they are. So one of the biggest needs is around, and concerns is around those very basics, which compounds the situation for trans and gender diverse persons, because many people will be faced with the choice of whether or not to take risks in trying to find a basic way to survive. So it's both, at the end of the day, it's both sides of the coin about a survival issue. So basically, for now, all we have been able to do is to try and have a collective effort amongst where we try to buffer the situation for each other as trans and gender diverse persons. So sending each other mobile money, trying to collect together food items within people's vicinities to assist each other to get by during this difficult time. But it is hardly enough. And unfortunately, we find ourselves in a situation where even governments are taking advantage of the situation, and there's also the issue of partisan distribution of food and commodities that should be assisting people at this point in time. Then with regards to the issue of mental health support, it's really difficult in this situation because most support that you will currently find is within the digital space, and access to those digital spaces is also it's not availed to everyone. You'll find many of trans and gender diverse persons are unable to access the only platforms that provide adequate information with regards of how to keep themselves safe. They don't have access to those platforms with regards to support and counseling that they need so much at this particular point in time. And also with the issue of many people having relying on alcohol and other substances in order to have a form of coping mechanism. So coupled with that, the withdrawal is also it's really traumatic what people are going through within their homes. Some often face physical threats. Others are threatened with eviction in itself. And just to negotiate a space to even keep to yourself within the family setting has a large impact on the mental health of many of our community members. Also, there are those that we tend not to really speak about most of the time and consider, which is people who are suffering from mental conditions. Right now, there's a disruption in the acquisition of medication because there's only one central institution that offers medication for mental health conditions. And also coupled with immobility, that means that a lot of people have to do without, even within a situation that puts so much pressure on one's mental being and wellness. And also in relation to HIV and other commodities, condoms, lubes, people are not able to access. People are presently unable to access the very bare minimum in order to keep them safe. And within a civic space that tends to alienate and isolate those working on issues, they tend to be what they call red button issues, working with communities that are criminalized. They also have not been availing that support in order to get people onto task forces, in order to get people to have paperwork, and so that they can be able to maneuver spaces in response to the different issues that may arise. So definitely in terms of our health concerns, we find ourselves at an all-time high in relation to the mental health impacts for trans and gender diverse persons. And the unfortunate part is the issue of allyship right now. This is the time when those called out to be our allies, where we would need their support, because without being able to have them open up some of these spaces for us in this point in time, the impact is devastating on many of our community members.
Thank you for that. Remember, guys, the hashtag for these conversations is hashtag amplifying TGDV. All right, amplifying TGDV. So please do use those handles to engage more of our community and also ensure that people listen to this conversation and tune in for the rest of the program and the activities that have been programmed online for us to engage on.
So I get, yeah. So what can we do as organizations? So the first thing, I guess, one of the conversations that have been happening on a regional level for advocacy purposes is to push for community involvement in interventions, and community involvement pushed by community-based organizations and by civil society organizations. Because what we are also saying is that, particularly with the communities that we work with, access to information for them is through us half the time anyway. So if we're not operating and if we're not at the forefront of fighting this COVID-19 pandemic, then our people are not getting reached with the right information, even if it's just even if it's just on countermeasures, right? And then the other thing that we've basically really been trying to do is see how we could leverage on the existing mainstream systems. So when government announced their emergency income grant, what we did was to see and mobilize as many trans people that we could to try and apply for it, because we knew that even the system in itself doesn't allow, isn't enabling. So a lot of our people would do the internalized transphobia thing and say, I'm not going to apply because it requires me to use that name on the document or whatever. But we tried to get as much people as we could to try and apply for that. The other thing that we try and do is then amongst each other, as Sam has said, try and raise food items here, food items there, to see how we could maintain each other as a community. As organizations, we are forever trying to tap into those emergency funds that are being pushed out to see how we could assist. But I think it would be about time that we start thinking about sustainable planning as the region and as a movement, to see how we could react to stuff like this when it happens. So proactively, I think planning in advance is an area that we need to get to as a movement. Yeah.
So I also think for me, one thing that's come out very starkly working in this area in the last few weeks is the new struggle that's opened up, the new front on the existing struggle for equality that we face is the digital divide. Because getting information to people in the context where we can't have public meetings now means online. Sorry, can everyone hear me?
Yes, I can hear you.
Yeah, thanks. So what we're looking at is just getting information to people. If you want to tell people grants are available, food parcels are available, where they are available, if you want to give people information about how to keep themselves safe and minimize risk, all of this information in a context where we can't have public face-to-face meetings is now having to happen through social media and online. And so what we're seeing is whether you have access to information or not, whether you're able to empower yourself or not with information, depends on where you fall on the digital divide. And I think this is the new front that's opened in the struggle for equality. And this is what we as organizations need to take up, is accessing data for our communities so that people can be able to access data, get information on the services that are available and how they can get help. and on how they can keep themselves safe through this pandemic. The other thing that I'm seeing interesting comments coming up from our participants here today is that this is the time when we need to start looking at, are food parcels enough? Are the existing social grants enough? With the failure of the state to respond to the poorest of the poor, is this not the time for us to be really pushing and adding our voices to the organizations that are calling for things like the basic income grant? And that's where I think we can start turning these challenges into solutions, into longer term solutions, rather than just putting a Band-Aid on this. Let's look at how we take this forward to really address these underlying problems that we've been facing for so many years.
Thank you, everybody. So the participants, if you want to raise a comment or if you have a question, you are allowed to raise your hand, and then I'll give you the opportunity to have your say. So basically what we are challenged with in many of the Southern African countries, except South Africa and probably Botswana now, is the fact that these countries have at least decriminalized and have laws and policies in place for the communities, even though on the ground there isn't much showing to this effect. So as trans and gender diverse persons, a lot of people will definitely feel that being on hormonal therapy is also a risk towards contracting, or is one of the underlying issues, right? One of the underlying causes that makes us vulnerable towards contracting COVID-19. So there is a relation between health and physical wellness, because if the one can't do without the other. And I do understand that during this conversation, a lot of issues have been raised around what governments are doing and what communities are doing, but we are trying to find solutions on moving through all of these challenges. Food parcels are being done, there are lockdown measures that are being done, we are being told to stay at home, social distancing, and all of these different variables that are within, that have been afforded by our governments and so forth. But the issue is this challenge surpasses COVID-19 as well, right? So we have been having challenges of unemployment, we have been having challenges of homelessness and all of those things. And during this time, how do we use this momentum in a way to actually ascertain the issue around homelessness is taken care of for good? How do we ascertain the issue around unemployment and people not being able to take care of themselves because of unemployment, especially when it comes to trans and gender diverse communities? How do we ascertain that aspect within this time, using this momentum, using the current grants available from the different donors? And also, how do we engage our governments to ensure that we strengthen our communication and also voice the concerns that are underlining our issues and that has been underlining our issues? Anybody want to have a go? Can everybody hear me? Can somebody hear me?
We can hear you, thank you. So I think that, as I said, I think that this pandemic that we're facing gives us an opportunity, because it's not normal anymore, but normal was never working for our community. We were the people who were losing out in normal. So I think this gives us the opportunity to start looking at some of the underlying issues. And if I can just take one mental health issue, which is suicide prevention. We know that our community is one of the communities that's at highest risk for suicide. And we can say, yes, this is a data issue. Again, we want to get people access to data so that you can phone a helpline, so you can get online counseling, so that you can connect with social media support groups that a lot of organizations are setting up. And get people to connect and get the support that they need. But really, the underlying issue that we need to address is the gender affirming healthcare, because that will then address the underlying issues with suicide. And we need to also address the discrimination that our people are facing in the community. So if we're just focusing on data and we're not looking at getting access to gender affirming healthcare and addressing our position of discrimination, in some cases criminalization in the societies that we live in, we're not going to be addressing the underlying suicide issues. And I think that's where we need to start looking at how do we form linkages with other organizations that are working in the fields of human rights, and start saying, in the context of COVID, can we drop all this talk of morality? Can we stop all this talk of scapegoating and start looking at public health? How do we get healthcare to people in a way that's going to address these underlying issues?
Thank you very much for that. As definitely it has been alluded to, suicide ideation and depression are one of the major challenges, right? And basically what I think and believe is that food parcels, right? Can it be delivered door to door? It's one of the questions that frequently come up, instead of just having a mass dissemination where most of the poorest communities don't even have access or get access to that. How relevant are the current systems in place that are being used to disseminate food parcels, for example? How effective are they currently? Because it seems they are not effective, so we need to think about some possible solutions. How can we solve the issue of food parcel delivery? How do we solve the issue of homelessness? And I think that is where my question is coming from, because many of our countries don't have policies in place, legal policies in place to protect us as trans and gender diverse persons. It doesn't even make provision on health passports and so forth for us to use our preferred names. There's so many different challenges with regards to all of this. Even when you are applying for social grants, you have to use your legal name and not your real name, for example. So these are some of the challenges that we face in the different Southern African countries, right? And we need to take it to the next level. So how do we need to take it to the next level? Participants are allowed to raise their hands and also give their sentiments and also guide. I think it's about time that we should have a Q&A as well. So please do raise your hands so that you are given the opportunity to respond and share your thoughts as well. Thank you.
Okay, so within our context, it's only in the last week where we've started to interact with some of the youth-led organizations within our city, because it seems only they are sort of willing to assist us in terms of bridging that gap for access for trans and gender diverse persons. All the other big civic orgs and civic institutions, right now the problem is people are in a race for visibility and a race to ensure that they are the ones that a race for funding, basically. So in terms of them then being concerned about organizations that work with the criminalized populations, there tends to be limited concern in that regard. But with the youth-centered institutions, this is where we're finding sort of a light at the end of the tunnel, and we're really hoping it is a yardstick of measure of the future that we hold. So already we have that youth initiative that will then within the next week look at ways in which those who are able to get accreditation then assist those from our institutions to be able then to access the community members that we work with. Then in terms of HRT, people are unable currently to access hormone therapy, mainly also because it is not illegal, or there are no systems in place within our country for that kind of access. And in as much as we do have medical practitioners who are willing to partner and assist us in that regard, so far we have had those who have been willing to go as far as arranging prescriptions, but also access to medication here. It would be 3 times as much as it would cost in any other country. So the issues around legality, also for fear of them and their practice, there tends to be a certain reluctance to then avail services in terms of something that does not have a national framework of access as yet. But definitely, I think for us, the light is with the partnering with the youth organizations for now.
So, Madam J, if I may, I guess the question is very broad and big, right? Because it speaks to a whole range of issues that I think for me is immediately stamped and dealt with when we get legal gender recognition within the country. So I guess the advocacy continues for access for legal gender recognition, for all these other entry points that we need to have complete liberation for, I guess, trans bodies. I think what we try and do in the interim is see how we could leverage on working with the existing systems that are not being very conducive at the moment, but I guess with our advocacy work, we persevere and we keep pushing, and we see how we could, and I see people discussing the food parcel issue. And the one way we thought about doing it was maybe if as an organization we could approach the central distribution system or whatever, or get a civil society organized so that we could perhaps identify members that are vulnerable within our communities, have this list available. With this list, through a national platform or whatever, be able to reach out to central distribution so that they drop the parcels off with us, so that we as organizations are able to see how we can reach our trans entities, right? Again, as we continuously advocate for economic emancipation and inclusion for trans bodies, and policy framework that will make sure that we have conducive work environments for trans people to be able to care for themselves. When we speak about gender affirming healthcare, as Sam says, it's not something that's readily available. It's not also within our national systems. And there's also the area around affordability and the costs that are affiliated to these. So as Anil said, perhaps advocating for it to be provided by state, but this would, for some countries, would have to be post-COVID, because if our countries will immediately tell you it's not a priority. And as Anil was saying, how do we then make this a conversation that people can recognize this as something essential for us as trans persons, because body dysphoria can lead to high rates of suicide for trans persons.
Thank you, Ms. D. Matimba has their hand up. You can share your comment, thought, or query. Thank you.
Afternoon, Jolarina, and everyone. Thanks. So thanks for all the input. I've been battling with this question because I think within trans communities we have spoken around this but never figured it out, and I think it has never been more relevant. Because while we're finding and trying to find solutions to help the communities we are part of and we do work with, are we also creating spaces for the activists that are doing that work to find wellness. Because what I've realized is, I think in the last few weeks, especially from this working at home thing, is continuous conversations with other activists and how we're all burning out at a faster rate than we ever thought working at home could ever equal to, right? And I think that becomes kind of scary if we don't know when this ends and we have to continue the work, but we're not finding ways and systems to protect ourselves also mentally.
Thank you very much, Zach. Anybody else want to have a go? Questions, conversations? A very valid point indeed, Matimba. Zach.
Yeah, that question I think has hit home for many of us. So yeah, and I think definitely it's definitely a very valid and important question, especially within this time, because um the impact of the lack of support for those who are trying presently to coordinate support for others could have it could have a disastrous impact on the work itself. And I think for now, what the best solution that is available to us is within the support systems within ourselves. Beyond that, it's difficult also because oftentimes those doing the work, it's difficult to show a sense of vulnerability at a time when uh, people are looking to you to be able to make things happen, or to try and avail access, or to get the issues that they are facing somewhat, at least to get some form of assistance. So definitely, I think this is an important conversation that as peers we need to take forward in relation to how we then strengthen and even motivate for better support, especially in a time like this.
Thank you for that. Lilac, you are live. You can give your contributions, please. Thank you. Yes, it is okay if you type, Lilac. If you are going to type, let's give it over to Zaza to also give your contributions. Thank you, Zaza. You may go ahead while Lilac is typing.
Hi, good afternoon, everybody. I'm Jaja. I work for RHI Trans Health Care as well as the director of Trans Power Care Center. So I just want to agree with Anil and also Deonce on the whole, with Anil on the database. And I think this is something that I've discussed with the Office of the Premier here in Gauteng a while ago, where us as NPOs and NGOs and organizations that deal with the LGBTI community needs to have a database of the people we deal with on a daily basis, because that is so important for us to reach out to them in instances like this. Now, door-to-door delivery could possibly work if we as NPOs and NGOs are actively involved in that delivery, because in doing that, we are making sure that our community is seen too. Because I'm in the other groups, with the sex worker groups that I belong to for transgender and sex workers, and also in the government groups that I'm in, a lot of the deliveries are done by heterosexual people, and they are only seen to their people. And also there's been a lot of talks about people delivering parcels to their own homes, and these are privileged people. So my contribution to the Department of Women, Youth, and Persons with Disabilities were that us as organizations that deal with the LGBTI community need to be in the front line assisting with the delivery of food parcels. Thank you.
Thank you very much for that, Zaza. And definitely, I would agree with you that many of these food parcel deliveries are done by, especially here in Namibia, if I can use that example, by our government, right, and our councillors' offices and so forth, and a lot of civil society organizations or trans organizations are not involved in part and parcel of these processes because we are on lockdown and we are not allowed to move around. And if we have to move around, we need to use essential services letters and permits and all of these things. And also with the permits, you need to go to a police station to get the permit from the police. And in turn, our identity documents are used, the legal identity documents, as it is said, are used to write this out, which further in turn also creates internalized homophobia and stigma within ourselves because we are invisibilized in that sense, right? And so there are, with the lockdown comes a lot of issues and challenges with our communities, apart from the food parcels and the access to healthcare and services. Also comes even accessing those services in themselves becomes a barrier due to exclusion and invisibilization of transgender people and gender diverse persons. And that creates a form of uncomfortability for people to access what is available. And also, yeah, so I believe that as organizations and as a community, as the Global South community, we need to hold hands and be able to strengthen each other and see how and where we are able to assist each other and guide each other, because this is a global pandemic that is definitely ravaging all of the whole world, and also not only the whole world, but will affect Africa most direly, right? I see that Sivosetu has their hand up. You can give your contributions, please. Sivosetu, Sifo, Sipo. Can somebody hear me? Hello?
Yes.
I can hear you.
Okay, Sipo, you have your hand up. Okay, so yeah, so if are there any closing remarks from our panelists, or if there are no other contributions from the audience, please let me know.
So if I can just say my kind of last remark, and maybe someone from the participants would like to also kind of comment on this on sort of way forward, is I've been reading recently about a very interesting American Zen teacher, Isan Dorsey, who was he identified as a drag queen. In his life, he was a sex worker, he was a drug addict, he was a Buddhist monk, and he founded a hospice for people who were dying of AIDS at a time when there was no ARV treatment for HIV, when ARV treatment didn't exist, and if you got HIV, you died of AIDS. At the time that he set up this hospice, he himself was dying of AIDS, but he went ahead and did the work and did it. And his message was to people was always, the path is under your feet. What you need to do and the work that you need to do is before you right now, and you just have to do it. And I think that's come home to me very much today, where we've raised all of these questions of the huge mountain that we have to climb and all of our difficulties and challenges. And the participants today have come with more questions and issues that we need to address, but they've also come with such interesting takes on linkages that we can make and strategies that we can adopt. And I think this is how we take it forward, is on keeping these conversations going and moving into a network where people are sharing ideas and sharing resources and working together to support each other and supporting all of us as organizations, supporting each other so that we go forward to meet all of these challenges that we're facing with creativity and with courage and with compassion.
Hey, so I think on my end, the conversation today really has given me a lot of insight. As the forum ourselves, we've been trying to figure out exactly what the impact looks like on the ground, what some of the pathways of mitigating this impact could be. And I guess there's a lot of advocacy work that needs to continue happening, but also figuring out what are some of the practical solutions, and seeing, also formalizing our strategies as a region around fundraising generally, and emergency response, and what that looks like, and being able to plan. I think also just being able to look at how we respond to human rights in a state of emergency, right? Because I'm thinking, looking at what we're going through COVID now, and what we go through, or what our normal has been, you sort of get a little bit alarmed, and you're thinking, but the situation is actually not that different. It's just heightened by these instances, right? So we need to scale up our work in terms of access to justice, and getting rid of human rights violations, I think, in our advocacy spaces.
Okay, basically all that I can say, for this point in time, it's really important to try and find ways to ways in which to cope the best way in which we can. Experiment with the meditation, with any form of way of trying something that is probably new but can be helpful to you to cope within this point in time. And what's also important is the constant check-ins on each other and members of the community, especially for those who are either isolated or within very hostile environments. So it's important to constantly check in on each other, and also to even to offload as individuals. This is a point in time where it's important to tap into that. But apart from the dire situation we find ourselves in, I think it's also important to take this point in time as a learning, to document all the gaps that have been amplified by the current situation. So we've talked about the issue of the digital divide. What can we do then to make that gap much shorter? What can we do now in post-COVID in relation to the skills that are needed by trans and gender diverse persons? Also working with the mindset that this will end. This will definitely come to an end at some point in time. And also with the issue of allyship, I think now it's the time also to really take stock of allyship and how it's purposeful, or can be more purposeful and meaningful for us as trans and gender diverse communities. But generally, now is the time to be more cognizant, more than ever, of those that are in the most need.
Thank you very much, everybody. if there are no more additions or comments, are there any more comments or additions from anybody before we wrap up this conversation, and then we'll have Liberty give us the final words and also the way forward after this conversation.
Thank you very much, Madam Jolarina. And I think just from our end as Gender Dynamics, we want to just contribute in reflecting on what the way forward could possibly look like over the coming weeks. So firstly, from our end, thank you for an excellent discussion by the panelists, Sam, Deonce, and Neil, and of course for the rich recommendations that you've also given us in terms of strengthening our work across Southern Africa as a collective. The next week, we are going to be looking at who can get access to this online platform. So we're likely going to be engaging with all of the in-country partners to see how we can funnel funding through to ensure that organizations can then get more people active on this particular platform and of course also contribute to shaping strategy. Second to that, as mentioned at the beginning, we have documented the outcomes and action points from this particular session. And in doing so, we're hoping that that will inform the strategy that we can come up with as a collective at a regional level. That strategy, of course, will be shared with the Southern African Trans Forum and the collective at large to see where we need to strengthen it before we even implement it to a greater extent as a means to strengthen the work that we are doing in Southern Africa. And looking at next week's conversation then, please keep a lookout on the online social media pages and on our websites to be able to get an understanding of what the actual content of those sections will seek to achieve. From our end, we really thank you for tuning in today and for sharing some of your insights, sharing some of your questions, and also participating in shaping strategy more broadly. Immaculate, from your end, are there any particular matters that you would like to address before we conclude this discussion?
Just to alert everyone that we will be sending through evaluation sessions, our evaluation forms for the session. Please do complete and send them back to us. That way it's going to help us in being able to improve and shape our conversations as we go forward. And thank you everyone for making time to participate.
And so with that,
thank you everyone.
Thank you everyone for a great conversation, to my panelists and everybody that took the time out to be here with us. Thank you so much. Bye.